Hi, I'm Dr. Chris Burrett. Welcome to the ACO's A Different Kind of Psychiatry case presentation webinar. We're glad to have you. Today's presenter is Dr. Salvatore Iacobello, and his presentation is entitled, A Middle-Aged Woman Hides Her Emotions by Partying and Drinking.
Hello, Dr. Barrett.
Welcome, Dr. Iacobello. Dr. Iacobello is a board-certified psychiatrist and a clinical associate of the ACO. He's in private practice in Fairfield, Connecticut, and he's an assistant editor of the Journal of Orgonomy, where he's also published articles on medical and social ergonomy. Dr. Iacobello, before we begin, I just want to let the audience know that at any time during the presentation, they can type in questions into the Q&A section. We'll get to those at the end. So I'm really excited to hear about your patient, and maybe we can start just by saying, who is this middle-aged woman who is partying and drinking?
Well, Maria is a middle-aged woman, as you said, in her early 50s, who has been married twice and who has raised two children of hers, plus two children from the second husband, and who, during the last year, say, before she came to see me, she had not been doing well, had been drinking and partying a lot, coming home late. At the time I saw her, she had moved out of her husband's house, was living in an apartment. So when this all was started by the illness of the husband, who was close to lose his life, and he had to stop drinking all at once. He was able to do that, but Maria felt at that point like she didn't know what to do, and she went drinking and partying on her own.
So was drinking and partying part of their relationship? Is that what you're saying? And then he had a reason to stop?
Drinking was very much part of their relationship. During the time they've been together, the main focus of their relationship was raising the children, and for the rest, they would spend a lot of time drinking. That was the main activity. They would go on vacation, they would be drinking. They would be drinking after work, during the weekends. She later on revealed to me that she always had known that her husband was not the person she really would have wanted to be with. But in fact, she felt, however, that this man was the right person for her because he was taking care of her. He was very good with everything. And so it was good for them to raise the children.
I see.
So the relationship was based on those two pillars.
So, Dr. Iacobello, were they divorced or separated before she came to see you?
They both, when she came to see me, she had moved out of the husband's house. I say husband's house because this was the house where she moved when they got married. So it was not a house that they built together.
I see.
In some ways, she felt like he was the main provider, the one who all had the house and was taking care of it. When she came to see me, she was living in an apartment. That was...
But still legally married to them?
Still legally married. So she had tried other times briefly to move out, but after 1 week or so, she could not do it any longer. She will emotionally break down. So At this point, she had moved out and had actually rent an apartment, but eventually her feelings of loneliness, depression, feeling overwhelmed were taking over, and she would break down in episodes of crying and panic attacks. At the same time, she would keep the drinking. Her drinking was mostly a social drinking. She would drink also by herself at times, but her main thing was she would go to a club, she would socialize there, she would drink, she would stay out late, she would pick up some men who she knew. At this club, there was the fact that her sister worked there.
I see.
That was an inducement to go and see her sister.
And so, Dr. Iacobello, how did she end up coming to you? What was she looking for help with exactly?
Well, she had 2 visits to the emergency room out of heavy panic attacks and breaking down in crying, feeling hopeless. The second visit, she was referred to an outpatient program. She started the treatment there. She, however, was not happy with the care she was receiving. She also didn't like being labeled as an alcoholic or as somebody who was abusing some drugs, because she had been prescribed benzodiazepines. So she was not happy about all this. So she looked for somebody who could treat her on an individual basis and who could understand her.
So prior to that, she'd never been in therapy or seen by a psychiatrist?
Never been in therapy. She mostly had been treated with an antidepressant and with an anti-anxiety medicine. This had been going on for years, but prescribed by a primary care.
I see.
And she never felt like she was somebody who had problems. But all this year, she was keeping drinking. Now, alcohol was part of her life. She grew up in a family where both parents were drinking all the time.
Dr. Iacobello, you describe her as almost blind to her own problems.
Well, we could say that in some way that's reflects her personality. Blind to her own problems, but I would say more blind to her own feelings. Because in some way she had been running away from her feelings by keeping herself in a state of constant excitation or expansion energetically. So, but now, once the husband was sick and I had to stop drinking, all her life fell apart. In some ways, she didn't know what to do. What happened soon was she started to run away. She couldn't be in the house.
Dr. Iacobello, I'm curious, what was it like when you first met in your office? How did things start?
Well, when I first met her, she was well dressed, with very much cared, with a nice makeup. She soon started to talk, to tell me her story. I liked her because she appeared to have a lot of emotions, but there were some striking features about her that immediately gave me, let's say, some warnings to see what was happening with her. I got the feeling that all this was very what she was talking about was very superficial. And there was a lot of drama. Although she had a lot of expression, but what she was saying was not in touch with the feelings that I could see on her.
You couldn't feel it from her?
I couldn't feel it. It was all like it was as if feelings.
As if she was feeling suffering and anxiety and depression, but you didn't feel it from her in the room as she talked about it.
It was clear that it was very dramatic. And the other striking feature about her was that she wouldn't look at me.
She didn't make eye contact.
She wouldn't make eye contact. She will always look to the left. Thing that she still does. A clear sign of avoidance. So on one side she's looking, on the other side, on the other she would be talking, and then there would be a smile that would come out of her lips. And the smile would be, I took it as having the meaning, well, this is not really true. So the smile was giving away something about her. Like all of it was a joke.
So how did you connect with her that first appointment?
Well, the first appointment, I connected with her by listening, by reassuring her, and also briefly I asked her to tell me what she was feeling. And this was superficial, but at least that gave her the opportunity for a moment to stop and just to feel.
Mm-hmm. And so then how did things progress from there after that initial appointment?
Well, I reassured her. Then I say that, yes, I could help her.
Dr. Iacobello, if I could interrupt, reassure her what exactly? What were you reassuring her?
Well, I think just saying that I could help her was reassuring.
That there was some kind of help that she could find relief?
That she could get. Then also, I accepted the story, because a story was very rich with meaning, and I acknowledged her experience, what she was thinking and what she was feeling. Mm-hmm. So, and then at that point, she committed herself to come for therapy. We also had discussions about the medications, because she was taking some medications that she didn't like the way it was making her feel. So I reassured her that she didn't have to feel like that eventually she could be able to come off her medications.
She was prescribed medicine before she met you, and you were saying it doesn't have to be that way. We can work through that?
Yes. Yes, we can work. And also I said, I can always give you medicines that don't have all the heavy side effects. Or she was taking, she had been prescribed. Now, her career, she has always worked for corporate companies at the corporate level.
Uh-huh.
So she has been doing always well in her job, and she also likes her job, mostly because it gives her the opportunity to talk to many people, interact with many people. At that time, however, she was working from home, and she's working from home, something that this is difficult for her.
Dr. Iacobello, were her kids at home or are they grown and out of the house?
The kids are grown and out of the house. They may be in their mid-20s.
Okay.
So the kids are on their own. The husband, he also works for some big corporation, and the husband always has been very accepting on her over here, and all through these events, she will move out, she will come back, she will come late home. He never was upset or angry or saying,
Wow.
you cannot do this. He would say, the way she describes him is, yes, dear, do what you had to do. You will be fine.
Mm.
The husband, at least at this stage, wouldn't show any feelings for her that she very much needs.
There wasn't a fight when she came home at 3 o'clock in the morning or she was driving.
Right. She feels that she would rather deal with that than have somebody who doesn't react. But the husband is very good at taking care of her. In some way, he's like the father. He takes care of her. If she's sick, he brings food to her. He makes sure she has everything. He takes care of everything.
And was he aware then that she entered therapy with you?
He knows that. Yeah, he knows that. He has known it from the beginning. And in some way, another thing that was making her upset was that her husband at times we make negative remarks about the therapy.
Huh.
And she didn't like it.
Like what?
Well, he would say things like, oh, your therapist must be, after you leave, he must be going crazy. He must need to see his own therapist. And other sarcastic remarks of that kind.
How could anybody be as caring and easygoing as me? It almost sounds like,
Yeah, right. That's besides that, they were in the past, and maybe still happening. He had been making comments or remarks about her that they are very inappropriate and out of place. Remarks like, I'm going to see your boyfriend, or you are this.
He was jealous, it sounded.
You are that. You are that. Jealous in some way, but at the same time, he wouldn't say anything. He would actually make negative remarks about her in front of her trainer, or a trainer, or in other social situations. And she hated it, but he would keep doing it.
I see.
So I think, go ahead.
I wanted to ask, did her drinking cause problems at work? Like you described her work as important to her and a good outlet, but did the drinking interfere?
No, the drinking never interfered with her work, as well as she didn't have any problems of other kind with the drinking. There have been a few times when she drove home under the influence, and now that's something that she really despises, that she did something like that. She's very upset with herself about doing that. At the same time, she never saw herself as an alcoholic.
Yeah, somehow it sounds like she was able to rationalize or minimize, or somehow, because it maybe didn't interfere with work, she could see it not as a problem.
Yeah, but also I think she was more focused on what the drinking was doing for her. I think the drinking for her is more part of seeking excitation.
Mm-hmm.
She's somebody who very much needs that interaction, that acknowledgement. She's the person who, when she goes to the club, she tells me people love her.
Yeah.
Oh, she goes there more for that than for the drinking. So at the same time, when she's in the office, I go to get her. So right there, she's smiling to me, and they just in an excited way. So apparently happy to come in.
Happy to be seen and heard.
To be seen and heard.
So maybe we could describe more of how her therapy progressed.
The therapy went through different phases, but I think once I saw that the talking was getting on the way, and the superficiality of emotions, as well as the running away from deep emotions, were getting on the way. So I started to engage her on asking her just not to talk, just to feel. I stay with the feeling. And soon what will happen is that she will break down in crying, a deep crying. And so at that point, I will let her cry, and at the same time, I will reassure her by saying that those were feelings that she had, and she needed to relieve them. And afterwards, she will feel better. So what will happen in the session is she will come in a state of turmoil and drama, and then I will ask her, well, let's see what's happening. Well, what is there? What is this about? What is it that has happened? What is that you are feeling? Let's say it could be something that happened with her husband. So I will help her to see and understand their own reaction, and that will take her out from the state of mind where she felt hopeless, she felt there was nothing she could do, that she was just a basket case, that the only thing she could do would be to die.
Was she suicidal, Dr. Iacobello?
No, she would talk about feeling like she wanted to die, she wanted to give up, she didn't want to be here. She never was openly suicidal. Although there was one occasion, the second time she moved out from her husband's home, when she indeed took so many pills that it was an overdose, and she felt like she didn't care about anything. And at that point, she could not have the session with me that day because of weather and other problems, but I came to know that, so I was able to talk to her on the phone, and I had to involve the husband to make sure that she would go to the hospital. And that was the time when she was actually hospitalized for 1 week.
I see.
Yeah.
So what's your sense of what happened there, where she was overwhelmed and overdosed?
What happened was that we had worked for some time. When she came to see me first, she was living in an apartment by herself, but she could not deal with that. Eventually, she had to move back with her husband. So, and
just so I'm clear, when you say she couldn't deal with that, she couldn't deal with dealing with things that are
feeling of loneliness, depression, despair. She couldn't do that.
Yeah.
So she moved back with her husband, who always was accepting and good.
But how did you understand that? How did you understand her inability to tolerate living on her own? I'm curious.
Well, I understood that she couldn't deal with the emotions that will surface when she would be alone by herself, and when she didn't have that kind of stimulation that she needs so much.
I see.
Because at the same time, she was working on not being at giving up alcohol. And that was too much for her. At that point, I felt that she was not strong enough to be able to be by herself. So we were working with the understanding that we go back to her husband. We work at getting stronger. Be more in touch with her feelings, knowing what she wanted, because that's another aspect of it, being very changeable and worrying all the time about what she needs to do, what she doesn't need to do. So that was the understanding that should we work at that.
So she was prematurely leaving the home before she was emotionally capable of sustaining it, it sounds like.
Yeah, right. That's what was happening. And also, before being able to just be by herself, this is a woman. Then these aspects of her childhood, growing up, emerge. And this is a woman who never been by herself. So she really didn't know, and is still working at trying to get to know herself. She didn't know who she was or what she wanted.
I see.
At the age of 13, she says she had her first boyfriend, and since then, she always had been in a relationship. Often not giving much time between one relationship and another.
Yeah, wow.
So at that point, I felt it was very important to rein in all these, all excitation and all these running from the deeper emotions. So she was with her husband. Eventually, she felt that she was ready to move out.
How did she get there? You know, from going from it was too much to, okay, I feel confident to do it on my own.
She had been more emotionally stable, and she also was realizing more and more that she didn't want to be with her husband. That her husband was a good provider, good at taking care of her, but there were no feelings. So she also had been able to stop drinking, or she was just drinking on occasion, well, when she would go out for dinner, or the few times she would go to the club. So at that point, she felt that she was ready. She actually went the way of consulting a lawyer. She was working on that.
Consulting a lawyer to get divorced?
Get a divorce, yes. Although I think you have a point there. Probably I would have preferred there to wait a little longer and be able to be more able to stand on her feet.
What was the time frame? Like, say when you guys started working together, and
this was about when, let's say, 11 months or 12 months since, when I started to see it.
To when she moved out on her own and felt confident that she could sustain it?
Yes, she moved out after 11 or 12 months that I had seen it.
I see.
So then, well, she found an apartment. This time she rented the apartment. It was a place she liked it. She wants to be there. While the first time the apartment, she didn't like it. For her, it felt like she was living just in a hotel, let's say.
Mm.
So, but she had this bad night when she felt completely overwhelmed, and that's what led her to go to the hospital.
And Dr. Iacobello, when you're encouraging her and helping her to just stand being in the office with you and not say anything and just tolerate her feelings, did any surprises come up? Did anything, was there pushback? How did that go?
She wouldn't push back toward me, although she would take any opportunity to avoid the feelings. But she's a very good patient from that point of view. She wants to get better. She's participating. But I think that one session that I remember very well strikes me is when I asked her while sitting. I asked her repeatedly to look at me and look away. So we did this for quite a few times. This is very difficult for her to do.
I just want to make sure I understand it. So you're sitting across from each other and you asked her to look at you and then look away and then look at you and back and forth?
Yes. And after we did that a few times, she broke up in a cry, very deep cry. So I think there is a lot of emotions that are being held in her eyes, and she avoids by looking away. As she says, I cannot look at people. I never did that. I've been always uncomfortable. So I think that was an important session because she came in touch with what some things she was running away, but also behind the crying there is fear. There is fear that also needs to come out, and I think she's in the process of learning how to work in therapy to release these feelings.
So if I'm hearing you, there is this superficial level of kind of excitement and fun, and then there was crying, and then now even below that, fear. And did it come up when you were doing that exercise between looking at you and looking away? Is it about herself? Is it about the other person, in that case, you in the room, where those feelings come from?
No, that is something that I'm not clear. Not clear at this time. I may have a hint because knowing her childhood and what she went through growing up, the lack of contact in her family, and also the fact that she was not allowed to show feelings in her family. She had to be the perfect girl. The family, they are two sisters. The younger sister, the parents didn't care about her. She could do what she wanted, but while her, she had to be perfect. She had all the perfect education. She had to be dressed properly. She had to be nice.
The model daughter, the model student.
She had to be the model daughter. She also she went to church, but on the one side, the parents were fighting all the time with physical violence too. The mother was mean toward her and never liked her. While on the other side, the father was very good to her and very nice, but he was drinking all the time. The father never was abusive to her or anything.
Good.
So I think there is this deep fear, a sense of loneliness due to lack of contact that practically she has carried up all her life, due in part being involved in relationships all the time.
Yeah.
On the other side, due to the drinking.
And there's a question from the audience, and I could ask it now rather than later. Did work with her ever proceed to the therapy couch, or was work done sitting up?
Yes, I have seen her on the couch too. I think right from the beginning, I started to introduce her to the work on the couch. However, there are times when I feel there is so much she has to say to relieve herself from those emotions, where I just have her sitting and we have the session sitting. But
I was just going to say, Dr. Iacobello, it gives me the impression that you'd have to be nimble along with her, because she could talk to get away from her feelings, and then she can talk and express her feelings. So it's not talking bad or good, but depending on if it's connecting with herself.
It depends in the moment, in the situation, because she also has a need to express herself, because I think she has a genuine need for contact. I think her nature is she's a very much a social being. She likes being around people. She gets excited by that. But
yeah.
At the time that can work against her and get her on the way of making contact. And that's a gradual process. She eventually, I think that was the first few months or therapy, she then came to the point that she could tell me, or she would come and say, "Oh, I'm doing good. I'm doing great. I've not been drinking and this and that. I'm good." But it was clear that was all. It was not genuine. It was false in some way. So, but she got to the point that she was able to tell me, "Well, I really feel that I'm just telling you what I think you want to hear." But no.
Did you recognize that on her own, or did you have to help her come to that?
I'm just telling you what I think you want to hear, but knowing this is true. Because in the prior sessions, there were times when I would point that out, this thing, how it was not real, what she was telling me.
Dr. Iacobello, that reminds me that sometimes patients will say to me, like when we first greet each other for the session, "How are you?" "Good." "How are you?" "Good." "You mean that? You're good?" I mean, you said good. It feels like this social nicety rather than actually taking...
Yeah, right. Yeah, that happens a lot with patients. But in her case, she actually was telling me, she would go deep into it about how she had not been drinking, how she was feeling fine, she was worried. So, but
being a good patient, doing all the right things, Dr. Iacobello.
Yeah, I could see that she was not there. The real emotions that she had were not those.
But you weren't calling her out on that when you felt it. You allowed her to reveal it to you. Is that what you're saying?
Yeah, at least I may have done it very briefly, because I think that's very important in therapy. You many times you can see things that are happening there in front of you, but you don't. You may actually avoid pointing them out because you can get a negative reaction. You know, not only that, but also this is a patient who is naive to medical organ therapy or character analysis. So she really doesn't know anything about the kind of work we are doing.
Mm-hmm.
Many times patients may take it in a negative way. You may point a character trait, but they may take it as a criticism or a negative thing that may actually bring the therapy to an end because they don't have that understanding.
Yeah. So you're sensitive about what to say, what not to say, and what would actually help her rather than what the intention of trying to help her, it sounds like.
Yeah, it's how to help it. So that's I think was very, very interesting. And then I'm helping her. She's realizing more and more that indeed she's just a little kid. She's a little girl who actually needs to have temper tantrums and release those feelings. She never was allowed to have temper tantrums at home.
I was curious if she ever gets angry.
She can get angry, but then the anger changes into crying.
Now, I've seen it where anger can turn into crying because it's a way of running away from anger, but also because there can be crying underneath the anger. How do you see it with Maria?
To me, it looks like she cannot sustain the anger because she has anger, but she cannot sustain it, and then she breaks down into crying.
I see.
And going back to the question, if I sit on the couch, yes, she goes to the couch. She gets relief from yelling and kicking, but there is one thing that she really finds very helpful and quiets down her mind. Is I use a laser light that I move on the ceiling, and I ask her to follow it while she breathes, and she finds that very helpful, and it comes very much.
So she's lying down on the couch looking up at the ceiling while you have a red dot on the ceiling to move around so she can move her eyes as she breathes?
Yes, yeah.
Can you help the audience understand what you're doing with that maneuver?
Well, I'm working on the muscular hammer over eyes, where the extraocular hammers are very contracted, and by mobilizing these, I'm trying to bring up more emotions. But also, the light stimulates the retina directly, and the retina is connected to the brain, so it appears that it can have a deeper emotional effect by actually reaching the brain. So it can have usually having a patient follow the light leads to a change of emotions or other emotions surfacing. Like I see patients crying when I ask them to follow the light. And I alternate that. Sometimes I use the laser light, but other times I just use the pen light, and I move it over their eyes.
Yeah. It sounds like, especially with her not wanting to look, to help her just be able to look and see what's in front of her and what's around her can be very helpful.
Yeah, right. That's the other aspect, to be able to make contact. Also, I think looking at the light, it brings them in contact not only with what they are looking at, but also with themselves.
Yeah. And it sounds like as much relief as that provides her, and as much as she's improved, you said she still has a hard time looking at you. That's how
Oh
deep.
yeah, that's very much. After we work on the couch, and then she sits up, and even if I ask her to look at me, but the eyes go to the other side. Yes, she's looking at me, but she's looking at me the other way.
Yeah.
So again, I say, just look at me and just feel. I think that's very therapeutic to just nothing has to happen, but just feel.
Yeah. Yeah. She's not quite there yet, it sounds like, but making her way.
But she has made, I would say, significant progress. The drinking, well, there was a series of events that led then to her stopping drinking.
Can we hear?
Yeah, well, she was trying to do it by herself, but she couldn't do it. So then, in a moment of despair, she called some helpline for people who have drinking problems. And this was at the beginning of when I saw her. And she ends up, I couldn't have any input on this. Sometimes you had to see patients going through their things, but there is not much you can do. In some way, you have to find their way. So she got into some kind of program in Florida. So she went to Florida for this detox rehab program, but she didn't like it. She didn't make it more than 2 days, probably, or 3 days. She didn't like the fact that they want to detox her. She never really has had any withdrawal symptoms. So she leaves the program. She comes back. She decides she's going to do by herself. She's going to AA meetings, and she's able to stop drinking by herself. But not only that, but now AA becomes a new social venue where she is socializing with everybody. She has become the center.
She's the belle of the AA ball now.
Yeah, she was a woman. So she enjoyed it very much. So then this lasted for so long, but then she felt that she didn't like the AA idea. She didn't see herself as an alcoholic in view of all the stories she was hearing from other people. So at that point, she lost interest, and she moved on. She said she can do it by herself. And since then, she has not been doing that kind of drinking.
There's this interesting dichotomy with her that she needs to be taken care of and needs to do it on her own, and goes back and forth, it sounds like.
Yes, I think that's something that has been happening a lot. But also, I think she's changeable, so she keeps at a certain point she may be committed to something. She's really impressed with that, but then she may change into something else. So as fast as she gets into something, so fast she can change. So that's another thing that I have in mind. So, and I feel I really have to pin her down and make sure that she stays where she is.
Mm-hmm. And do you see her as strong or fragile? Or I'm curious about her self-perception of the stuff she's made of.
I'm not clear about that. When I see her on the couch and she's breathing, I get the feeling that she may be quite vulnerable. And that's vulnerability has not come up, has not surfaced. On the other side, she can be very strong. She stands up for herself. Although she's petite, she doesn't seem to have much of muscular mass, But she tells me she can lift 200 pounds. And when she does
Sounds pretty good to me.
her training, for years, she has had a personal trainer. But of course, physical strength is not emotional strength.
Yeah.
I think she has a strong need for emotional conduct that has not been met.
Yeah.
I think she needs that, and now she is in this relationship where she has a husband who is perfect, never gets angry to her, never criticizes her. He takes care of everything. He talks to her in terms of, yes, dear, do what you have to do. It's fine.
Dr. Iacobello, there's a comment from one of the audience. It sounds as if the husband is afraid of losing her, so he accepted everything. Do you see it that way? How do you see it?
I'm not sure. I think I have not met the husband. I spoke him once. But I think more that the husband is he's flat. He doesn't react. He is very much involved in his own things, but emotionally he's cut from other people.
I see.
I think that's what I see more. Also, there is a fact that the husband stopped drinking right away, but he went into smoking, not actually smoking, but using cannabis.
He went from one drug to the next?
Yeah, so he from what she says, he's always under the effort. He uses edible. So I wonder how much the cannabis contributes here in keeping him flat.
Yeah.
Or reacting.
Was couples therapy ever something that came up that in your mind or from them?
It has come up, but there's been not much progress there.
Dr. Iacobello, we're coming to the close. I'm curious, where are things now with Maria?
Well, she's working at being able to live by herself, to be able to tolerate more of her emotions, and also working at letting them out in therapy. And, she also is working at being able to definitely separate from her husband and not, looking at him for any kind of help or, anything that happens. That's where she is right now. Know that she has decided that she's going to move on, because I'm not really clear. Maybe this is the best relationship for her. But the main focus is to help her to figure out what she wants. Because right now she's caught in the situation either being miserable with her husband or being by herself, but then not being able to deal with the other emotions that may surface, and then she may run out to socializing or picking up somebody she knows or even drinking.
Yeah. And what's the status of her husband's health?
That's something I'm not really clear with that. The fact is he doesn't tell her anything.
Wow.
So from what she says and happened to him, I'm afraid that indeed he may be quite sick. But at the same time, I have seen people who, with those kind of conditions, they actually can recover and do well. So,
can you say what the condition is or no?
Well, I know what the condition is, but I don't know. I don't want to say it here.
I understand. Okay.
Privacy reasons, but you know, actually, I have a few other patients that are in similar situations, and they tell me that they have recovery.
So it's not like he's on hospice or something like that where he has 6
He's
months.
not a house. He's working. He's apparently he's very successful in what he does. He's one of the higher up in some kind of high technology company.
Gotcha.
So by work is his main thing. And then he takes care of the house. He does everything. He provides with everything. She never has had to worry about the financial issues. That's where the situation is right now. So I don't know how he's actually doing it because he doesn't tell it. He just says, I'm fine.
Good. So, anything else about Maria's story that we didn't talk about that you think's important for the audience to know to have the full picture of her treatment with you?
I think these are the most significant aspects of a treatment. I think one thing I could add is that, basically she's this little girl who, I think, who was deprived of a genuine relationship with her parents, and she had to run away on her own to avoid the misery of the household. And that, she kept running, and now things in some way they are coming to the point that she cannot avoid dealing with those issues any longer.
Yeah. Is that her goal now in therapy to address these deeper feelings? How does she see it right now in terms of what she's working towards?
Well, her goal is that she wants to have a more meaningful life. And she wants to have a partner who loves her and shows feelings. Of course, she also wants to be able to stay away from alcohol and to be emotionally stable. But that's what she feels she needs. She needs more.
Yeah. Dr. Iacobello, there's 2 questions before we finish. One was, would you describe Maria as impulsive in her behaviors and actions, decisions? Do you see her as impulsive?
No, I wouldn't say that she's impulsive, although she's been doing these things, but in general, she's not impulsive.
So I guess the way I hear it is she can shift how she's looking at something or thinking about something or feeling, but it's not that she just, acts quickly.
No, she's not somebody who acts quickly. And, I think she more acts out of trying to avoid her negative emotions.
Mm-hmm. Yeah. And the other question was, how do you see going to AA as being helpful for patients? How do you look at that? Because I think you mentioned she kind of sought that out. It wasn't that you recommended that for her. How do you look at that question in terms of helping a patient be sober?
I think AA can be life-saving for many patients, and I recommend patients to go to AA. But people are different. What works for one person may not work for another.
Sounds like you're not dogmatic about it.
Yeah, no, I'm not dogmatic. In her case, at that time, I was recommending to go to AA. Mm-hmm. And I wanted her to go. And maybe, I don't know how things are going to turn. In her case, they have turned in the positive side, in the
Yeah.
positive direction. So I feel that she doesn't really need to go to AA, but for other people, yes, it may be life-saving.
I like that you said that, Dr. Iacobello. You're paying attention to how the patient's actually doing.
Yes, I think that's what we do, right? That's
Yeah.
we smart. Yeah.
Yeah. Dr. Iacobello, this has been a wonderful discussion, and we've had good questions. What would you like to leave the audience with before we finish up?
Well, one thing is that medical organ therapy can give a different kind of help to patients who are caught with substance abuse or mental health problems. But also, I want to point out how important it is to be able to engage the patient and transition them toward biophysical work. And in the setting that we have today, one has to be flexible and use the different tools that medical ergonomy gives us to be able to help the patient. Adapt your tools, your understanding to the single patient. There is not a mechanistic way of treating a patient.
Well said. I agree, Dr. Iacobello. Thank you very much.
Welcome, Dr. Barry.
Thank you to the audience for joining us today, and a special thank you to the donors of the ACO who make our work possible. I hope you join us for our next webinar, which will be on Saturday, May 18th at 4 p.m. Eastern Time. Dr. Phil Heller will present how a man with cold hands, nausea, and panic attacks conquered his anxiety, presented along with host Dr. Susan Marcel. In the meantime, I hope you listen to our podcast, A Different Kind of Psychiatry podcast, and check out the Journal of Orgonomy that's now on Substack. We'll see you next time. Thank you.